In the last 1 week alone, a total of 2,738 patients placed under home care-based program have recovered from the disease. There are still many more who are currently placed under the program, and we want to wish them quick recovery. This is a major success in the fight against the disease, a disease that has ravaged our country and put the lives of many Kenyans at risk. Even as we continue to ramp up other measures to curtail the spread of the virus, the success of the home-based care program for those infected has given a whole new impetus in this fight. More importantly, the home-based care program will free up our health facilities to provide the usual care for all other patients with diseases other than COVID-19. When managed from home, the asymptomatic cases would have the better home environment, which psychologically enables them to recover faster and resume their normal lives. It is also more cost-effective because it is cheaper, noting that 80% of the amount of money spent by a patient in a facility that cares for COVID-19 goes towards the purchase of personal protective equipment used by healthcare workers. Fellow Kenyans, if I now move on to our COVID-19 situation in the country, over the last 24 hours, we have 637 new cases of COVID-19, following the testing of 4,275 samples. Our total number of positives is now 14,805. And the total number of tests that we have conducted is 254,273. Of these 637 positive cases, all are Kenyans with the exception of 14 who are foreigners. We still see the skewed distribution between males and females. 361 of these are males, 276 are females. Again, no distinction in terms of the age of those who are found to be positive. Among these, the youngest is a 1-year-old infant, and the oldest is 88 years old. The new cases are distributed in the counties as follows. Nairobi recorded 342, Machakos 85, Kajiado 57, Kiambu 51, Nakuru 22, Mombasa 17, Nyeri 13, Busia 10, Muranga 9, Uasin Gishu 6, Bomet 5, Kericho 3, Kisii 3, Marsabit 2, and Narok, Vihiga, Meru, Embu, Garissa, Homa Bay, Kakamega, Kilifi, Kirinyaga, Kisumu, Kitui, and Laikipia have 1 case each. I'll just give you the breakdown of by sub-counties in Nairobi, since that's where we have the largest number. We have recorded 342 cases in Nairobi, as I mentioned earlier, and these are from Kamkunji, 44, Westlands, 32, Langata, 31, Embakasi South, 26, Dagoretti North, 24, Embakasi East, 24, Kasarani, 23, Embakasi West, 19, Kibra, 18, Makadara, 17, Starehe, 17, Ruaraka, 14, Embakasi Central, 13, Embakasi North, 11, Roysambu, 11, Mathare, 10, and Dagoretti South, 8. Machakos, with 85 cases, is distributed between these sub-counties of Athi River, 73, Machakos 11, and Kangundo 1. Kajiado's 57 cases are from Kajiado North 25, Kajiado East 20, Kajiado Central 10, and Loitoktok 2. And in Kiambu, the 51 cases are from Kabete 12, Kikuyu and Thika 7 each, Lari and Ruiru 6 cases each, Gatundu 5, Kiamba 4, Limuru 2, Githunguri and Juja 1 case each. The breakdown of the other counties is provided in the document that you will receive. On a positive note, as I earlier told you, we are continuing to witness many recoveries, particularly from the home-based program, home-based care program. Today, 499 patients have recovered, out of which 406 are from the home-based care program, while 93 have been discharged from the various hospitals where they were receiving care. This brings the total number of recoveries to 6,757, and we want to express our gratitude to our healthcare workers for this commendable work that they continue to do under very difficult circumstances in the front lines and within our facilities. At the same time, unfortunately, we have lost 10 patients from the disease, bringing our total losses to the disease, in deaths to the disease, to 260. Our heartfelt condolences to those who have lost their loved ones.
Like any other condition, of course, we recommend that you have a wholesome diet made up of all food groups, including the micronutrients from fruits and vegetables, which are important in enhancing your immunity. So we encourage everybody else, not only those who are suffering from COVID-19, but everybody else, to be able to ensure that they have a balanced, healthy, balanced diet. But on top of that, of course, you need to remember the infection prevention control measures. Taking a well-balanced diet without washing hands, without wearing your mask, without keeping physical distance will not protect you from COVID-19 disease. It is good to have a wholesome diet, but remember infection prevention control measures are very paramount for you not to get COVID-19 disease. But in case you get it and you have a balanced diet, the different food groups will work together to ensure that your body is able to sufficiently fight that disease and ensure your recovery. Thank you.